Next, Senator Boyer.
Thank you, Madam Chair. My question is for Dr. Buchman. During our public consultations earlier this year and the Indigenous Roundtable, it was talked about, one of the issues that was raised was that Indigenous peoples may choose MAID due to a lack of access to adequate healthcare services. And we heard about vulnerable populations earlier. For example, lack of culturally appropriate palliative care programs, pain management, health supports, etc. Some indicated that the best protection or safeguard would be to improve access to culturally safe healthcare services and other social supports. This is backed up by data from a recent Statistics Canada report indicating that 1 in 10 First Nations people living on reserve reported that they had unmet healthcare services and that in the last 12 months. In your opinion, does the lack of access to adequate healthcare services restrict Indigenous peoples' access to MAID?
Thank you very much for your question, Senator. I think it's similar to all areas of healthcare. The lack of adequate resources to our First Nations and Indigenous peoples across the country is compromised. We don't have adequate access to healthcare services, and that includes, of course, palliative care. They would also have the same restrictive access to MAID. At the CMA, we've been advocating for culturally sensitive, the cultural humility that's required to provide care to our First Nations and peoples across the country. So it's absolutely critical that access to all health services be improved for First Nations populations across the country. It's completely consistent with the policy. So they need access to palliative care, but they also need access to the option for MAID. We are working very closely with groups across Canada who are focusing on providing culturally sensitive palliative care to all First Nations peoples as well.
Thank you.
Senator, you have any other questions?